everyone. It is Wednesday, May 13th. This is 𝘿𝙧 𝘿𝙧, Performance Plus Physical Therapy. This is Q&A with Dr. D. I'm just getting set up here. How is everyone doing today? It's Wednesday, it's hump day, guys. How are we doing today? How has life been treating you? How has the week been treating you? Drop some comments and let me know how you've been doing. We've been doing this series for a while, guys. Well, I've been doing this series for a while, and I'm hoping that you guys are getting lots of value from this. If there are things that you want me to talk about, please let me know. Drop it in the comments. I'm happy to have a conversation with you directly or just speak generally to that topic. So if there are things that you'd like me to talk about, let me know. Hey, Soul Boy, how are you? So I hope everyone is doing well, and again, you guys are getting a lot of value out of these topics and these conversations. Okay, so guys, today's question, just gonna get a little bit of time for people to hop in and then I'll get going. Today's question that I'll be talking about is, what is a labral tear? And this, hey Alan, how are you? And this is something that is an injury that happens on the shoulder that's very interesting from a rehab standpoint, and also for you guys from a patient standpoint. Very interesting thing. There are similar things that actually happen in the hip because the anatomy is similar. The way it presents is a little bit different. And we'll get directly into that so we can educate you guys about exactly what a labral tear is, how you may be able to identify what a labral tear is for you if you do have those symptoms, and most importantly, how can we help you in terms of physical therapy? What things can you do in order to make sure that this is something that you can get over, get through, and get back to your life? Okay, I see some people coming on Facebook. Hope you guys are doing well. So guys, we'll get straight into it, okay? When we talk about a labrum, guys, I'm just bringing up my anatomy model here for you guys. We are talking again about the shoulder, and the anatomy of the shoulder is very interesting, as we talked about before. You have this really interesting ball and socket joint that sits right there, okay? And then you have this shelf that happens, as we talked about before, that sits right on the top part of the shoulder joint. And then you have that it's really kind of attached to your shoulder blade, as you can see from that side right there, okay? And that entire thing kind of attaches to your rib cage. So there's a lot of moving parts when we talk about the shoulder, okay? The anatomy of it is interesting, and it really kind of predisposes it to a lot of the things that can happen with the shoulder. A very interesting thing that you want to note when you're talking about the shoulder joint, so you guys can see there, is how big the ball is. And I'll shift this around. Let's see if I can shift it that way. Yep. Is how big the ball is. Hold on one second. Apparently I cannot do that back ways. Okay. How big is the ball of the shoulder, and then how big is the socket? Okay. So the socket is what we call the glenoid fossa, and the ball is what we call the humeral head. Okay. Now, as you can see from an anatomy standpoint, is that the socket or the glenoid fossa is a lot smaller than the ball. So we have a discrepancy in that joint surface in terms of where those two things attach, and that is going to affect how stable that joint is. In order for the body said, okay, this is not a particularly stable area. We're going to make this more stable so that you can have the most mobility that you can have. So we created something called the labrum. And the labrum is a rim of cartilage. It looks like a cup, and it sits right in that glenoid fossa, right over there. And that gives it more surface area that it can actually attach to that ball from a more stable standpoint. It is the area where all of the ligaments of the shoulder that come in from the muscles attach, and all of the tendons also cross a lot of that area. So basically, the purpose of the labrum is really to increase the surface area of that joint, okay? That gives it more stability. And again, if you can look at any joint, any ball and socket joint that you guys have. If you have a change in the surface area of one versus the other, you're gonna have a joint that's not quite as stable, and you guys can easily see that, okay? The purpose of the labrum is to increase the surface area of that joint to give it more stability, okay? That allows it to get a lot more degrees of freedom, what we call in physical therapy, meaning you can move in all directions without having any problems, okay? All right, if you do not have that stability, you're not able to really have those degrees of freedom to the extent that we do have at the shoulder. And we have six planes that we can go in. We can go up, we can go down, we can go to the side, we can rotate up and down, and then we can go across our body. And then of course your combinations of all of those directions. In order for you to do that, if you're thinking of a ball and socket joint, you have to be stable in all of those directions. Okay, I hope you guys see that. Hey Jen, how are you? So again, when we're talking about the labrum, that's what we're talking about. That rim of cartilage that surrounds the glenoid fossa and increases the surface area of the shoulder. Now, what happens with a labral tear is that basically that cartilage that sits right around there gets torn. And it's usually torn either by microtraumas, what we call microtraumas, meaning repeated stretching over time, or repeated small micro tears over time, or you can have a big traumatic event where you've had a fall or some sort of injury or some sort of impact to that shoulder, okay? Now, when you have a labral tear, there are specific symptoms that you're going to start noticing in your shoulder. A lot of the times we would ask questions, do you have any clicking or locking or catching in your shoulder? So clicking means that as you move it around, you feel a click, like a click, that sort of thing, right? Or if you feel like there's something catches, you move your arm up and you feel like it snags on something and then it keeps moving. Or if you feel like it locks, so you try to go in one direction and then it stops you. You can't go as far as you can on the opposite side after your injury. So those are one of the biggest things that we look for when we talk about a labral tear. We're looking to see if you have any sort of symptoms that's going to interrupt the degrees of freedom or how fluid your motion is, or even stop how much you are able to move altogether, depending on the type of labral tear that you have. Okay, so when that labral tear happens, there are two ways that you can do it. You can either have what we call a slap tear, and slap is an abbreviation for superior labrum anterior to posterior, and that describes the direction or the area of the labrum that is torn. Or you can have what we call a Bankart injury or Bankart lesion, which is basically if you've fallen onto that shoulder and it dislocates, then you've either torn the front or the back of it. And usually there can be some sort of injury to the actual bone itself when that happens, okay? Most frequently that happens is usually a slap. That's what we call a slap tear. There are 4 different degrees of a slap tear, and it goes from most involved, of course, to more involved. So the first one, which is the first type of slap tear, which is a grade 1 slap tear or slap tear 1, you just have a little bit of fraying right at the top of the shoulder. With number 2, you start getting the biceps tendon, which actually inserts onto the labrum involved also. That starts getting torn a little bit. With a slap 3 tear, hey 𝘿𝙧, hey Nicole, how are you? With a slap 3 tear, you have what we call a bucket handle lesion. So it almost looks like, you know how a bucket handle kind of folds over? If you look at it at a picture at the side, typically you'd do an MRI to get a picture of this. You would see that it's kind of folded over that way. And then with a grade 4, you have even more of that folding happening and even more involvement of the biceps tendon. Okay, so there are quite a different categories that we categorize that in. All of those categories now mean that you have to maybe have a different type of intervention in order to fix your situation. Of course, slap lesion 1 and 2 is the least involved because less of the labrum is actually involved. But slap 3 and slap 4 is more involved, and typically for those people you do need some sort of surgical intervention to make sure that you have your full range and you're not in as much pain, specifically if you are an athlete, okay? So with a Bankart repair, if you've had a Bankart lesion, that actually means, hey Chance, how are you? If you've had a Bankart lesion, it usually means that you have had some sort of interruption to either the front or to the back of the labrum. So usually it dislocates that way or that way. Usually the first line of treatment that happens is that you need to go to an orthopedist, of course. If you've had some sort of subluxation, which means a change in the positioning of the shoulder, or dislocation, meaning that the shoulder is completely out, you need to get that what we call reduced, which means put back in. And then they usually go with conservative routes in terms of doing physical therapy to strengthen, to improve your range, decrease your pain and swelling before they look at something of a surgical intervention. That's very common. Okay, so that's kind of a big picture of what a labral tear is, guys. Labral tears are very common in overhead athletes, people who use their shoulders a lot. Baseball players and pitchers are this is a very common injury. If you think about what a baseball player does, they usually go this way. I'm right-handed, so I'm going to turn this way. They're right-handed, and they usually cock the ball back as far back as they can. They throw it at you at a very, very fast rate, and then they have to decelerate that motion in that internally rotated position, okay? When you're getting that, you're getting a lot of strain and a lot of stress across that shoulder joint. It's very easy for them to start getting fraying at the top of the labrum, right here, and then also into the biceps tendon that lies in the front of the shoulder. So it's not uncommon for baseball pitchers and even maybe swimmers, volleyball players, tennis players, to start getting pain at the top of the shoulder and also on the inside of the shoulder. So if you guys are noticing in your daily activity, specifically if you're very active, that you're starting to get pain here, and notice that as you do something, click, 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 or you feel like there's a click or a catch or a pop somewhere as you're moving your arm, there may be a chance that you have a labral tear and you want to get it evaluated, okay? How do we evaluate for it as physical therapists? There are a set of orthopedic tools and tests that we do in order to make sure to eliminate all of the other potential diagnoses, to make sure that that's a diagnosis that you have. We do have clear diagnostic tests for that. You can also get an MRI. You can't see quite that on an X-ray. An MRI is something that you would need to get in order to make sure that you can confirm the labral tear and also the degree, because we can tell if it's present or not. We can't quite tell. We don't have X-ray eyes. We can't tell to what degree, so you would need an MRI to diagnose that. Once you've gotten that information, hey Kurt, once you've gotten that information, guys, now is the next step to figure out with your orthopedist or with your physical therapist what's the next best step for you, okay? For most people who have had a lower grade slap tear, grade 1, grade 2, to a certain degree, grade 3, it all depends, the details all depends. Chances are you're going to go through a conservative process and you will go through physical therapy. Things that can help with that is mobilizations that we do in terms of making sure you have your full range of motion, strengthening exercises to really control the rotator cuff muscle that really controls the rotation and also some of the elevation of the shoulder, and then also making sure that you're strong in all of those mechanics to make sure that things are doing really well, okay? If those things don't work, guys, there are other tools that can be helpful for you. If you're having a lot of pain and swelling, it is typical for physicians or orthopedists to give you some sort of pain relief in terms of injection, usually cortisone or some sort of corticosteroid. If these things do not work, you may be looking at a surgical intervention. I always recommend that you get a good consult, you get some good diagnostic eyes on you to make sure that you're starting in the right place so you end up in the right place. Shoulder surgeries are difficult, and anyone who's had some sort of surgical intervention knows how difficult surgeries can be. You definitely want to get and do all of the things that are on the conservative side first before you go into something that's more involved in terms of surgery. Okay, so that's what a labral tear looks like, guys. Taurus says yes. Thank you, Taurus. I appreciate that. So that's what a labral tear looks like, guys. Do we have any questions? Drop some comments, drop a question in for me in terms of shoulder pain. Have you had it before? Have you heard of someone who's had a labral tear before? How did they get through it? Have you had these symptoms before? How did you deal with it? Do you have additional questions for me regarding this? Drop some comments in so I know that you are listening and not just come in to say hi, but also drop some comments in if you do have questions. I'll wait for a minute or two to see if you guys do have questions. All right, got quite a few people come in here, which is awesome. Glad you guys can join me. And tomorrow, guys, heads up for you guys, I'll be doing this a little bit later in the day because tomorrow I have a guest, okay? And my guest is going to be Miss Tamika Duncan. She's an amazing professional, and we're going to be talking about rotator cuff conservative to post-surgical care in terms of physical therapists that can provide for you. So we'll be talking specifically about rotator cuff tears. If you've had a shoulder injury, there's a good chance that you have done some sort of rotator cuff strengthening. That's a fact, okay? The rotator cuff is a very key component of shoulder strength in terms of controlling the mechanics of how it works. We're going to go over all of that fun stuff tomorrow. So please tune in. It's going to be at about 6:30 tomorrow. I'll post the information in my IG stories and also online for you guys that are listening. I'll post it there for you guys so that you guys can drop in and listen to all of the fun things that Miss Tamika Duncan has to say. She's an amazing professional. Okay? So for the guys that are on, any questions about shoulders before I head out, let me know. Drop something in the comments. Hope everyone is doing well. Dayton says also informative. Any issues with your shoulders? Have you known anyone with this issue before? Nope. All right, guys. So if we don't have anything else, I will see you guys tomorrow, 6:30 p.m. I will put it up here for you guys to take a look. We'll be talking about rotator cuff. Very important component of the shoulder for you to understand. Please join me, tag a friend who this may benefit, and I will see you guys soon. Bye.